Okay, we are live.
Thank you, Daniela. Looks like we have a number of people who are signing in. We'll give people just a moment. Good afternoon, everyone. My name is Carol Burnett. I'm the director of the Mississippi Low-Income Child Care Initiative. We want to thank you for joining our webinar this afternoon. I'm so delighted to have Susie Evans with us, who is from the Office of Child Nutrition. She is going to be talking to us about the Child and Adult Care Food Program. And just to remind you all, so those of you who've been on the webinars before will know that there is a place at the bottom of your screen where you can see Q&A. And if you go there, you can type your question in and I will ask your question. What we're going to do is have Ms. Evans give us an overview and an introduction to tell us about the latest news from the CACFP program. And when she is finished, then we will ask the questions that you have submitted in Q&A. There is a chat function that you can see to the side of your screen. And if you want to type in that part of your screen, you're welcome to indicate any audio problems or technology problems that we need to address. But the Q&A is where it would be helpful if you would type the questions that you have for Ms. Evans. I want to thank you so much, Susie Evans, for being here with us today and bringing news to us from the CACFP program at the Mississippi Department of Education. So I will turn it over to you.
All right. Thank you very much, Carol. I wanted to thank MLICCI for actually organizing this webinar and inviting me to come and speak to CACFP program operators in this forum, in this format, to kind of discuss the Child and Adult Care Food Program and how providers are able and eligible to serve meals and in what capacity during the COVID-19 crisis. The first and foremost, the state agency has been working remotely since March 16th, and right now we're scheduled to continue in that manner through April 17th. So if you've been trying to call the office, you're not getting a response, but you can go to our website and email any of the CACFP division staff if you have any questions or concerns. That's our primary mode of communication, which is again why this webinar is so wonderful. A couple of updates. The health crisis, the coronavirus health crisis has presented some very, very unique challenges for CACFP program operators, particularly surrounding the service of meals and in what capacity, what's the safest way to do it. In response to the crisis, the Families First Coronavirus Response Act was passed by Congress and signed by the President. And some of the flexibilities in that legislation allowed CACFP program operators to begin serving meals in a different way. So the state agency actually applied to implement some of the waivers afforded in that legislation. And just yesterday, we notified all of our CACFP program operators via email of the process for how the process for serving meals during the coronavirus epidemic. The 3 waivers that have been granted are: 1 is meal service times. USDA issued a nationwide waiver to provide flexibility for organizations to be able to serve meals outside of the meal service time requirements. Specifically, that waiver allows program operators to serve multiple meals at one time, because everyone's familiar with, I serve breakfast at this time, I serve lunch at this time, my snack is at this time. In order to minimize contact, if program operators are able to bundle meals for their enrolled participants, they could possibly serve 2 days worth of meals at one time if they have that capacity. The second waiver that was granted was the waiver for waiving non-congregate feeding. This allows for CACFP program operators to serve meals in a grab and go style. That's exactly what the school districts are doing. When you're hearing grab and go in reference to school districts, that's the summer food service program. That's the other federal feeding program that our office administers. So now that's really game changing for CACFP organizations. So now the third waiver is related to the activity requirement for at-risk after-school programs for any of the organizations that actually operate at-risk after-school programs. In order to be eligible, an enrichment or an educational activity has to be offered at each of the sites in order for meals to be able to be served. That doesn't coincide with the social distancing requirements. So we've applied and received a waiver to waive that activity requirement. At-risk sites can now serve meals to enrolled participants while not offering the tutoring or the music educational classes or the karate or whatever the activity that generally drives participation at those sites. We have a really simplified process for notifying the state agency of your decision to serve those meals. We've created a CACFP non-congregate meal form. The organizations, you're going to list the name of your organization, your sites, if you're currently closed, because even if you're closed, you can offer meals to your enrolled participants. You don't have to open back up to be able to serve meals, because again, the social distancing is so important right now. That form is going to be uploaded into the MARS application. You'll hit submit. That's going to notify the state agency of your intentions to serve meals and at what sites. The key here is that you have to serve meals at approved sites, and you're serving the meals that you are approved for. If you're approved for breakfast, lunch, and snack, those are the 3 meals that you can serve at your approved sites. Also, we've created a modified meal count sheet, because the requirement for CACFP organizations is that meals are served only to enrolled participants. We've created a meal count sheet where meal count can be taken by participant's name, by each day of the week and each meal service. So if you have a child that's receiving meals for Monday and Tuesday, you can use the same meal count sheet for that child. It's just a way to track your enrolled participants and the meals that they're receiving. And that is my final update related to CACFP organizations serving meals during the unanticipated closures. Any questions?
Thank you so much. So far, if those of you who are listening have questions, please remember to type them into the Q&A section. We have one question right now. Would we have to restock our freezer if we are out longer?
Given the uncertainty of the crisis, I think it's prudent to actually purchase meals, meal components as they're being served. We've received quite a few inquiries about perishable and non-perishable items. In serving the meals during this crisis, the health department's primary concern is that meals be as low risk as possible. If there is a need to take or modify inventory, organizations have that capacity. But if meal components and food items are being used to serve meals at this time, they wouldn't have to be restocked. You're operating as normally as far as food purchases and your inventory.
All right. Here's another question. What should centers do if they can't find milk? Is it still a requirement?
Yes. In the state right now, we actually have an excess of milk because the primary consumer of milk right in the state is child nutrition programs. So just yesterday, Secretary of Agriculture, he issued a plea to grocery stores to remove the limitations surrounding the purchase of milk, because I think that's what's impacting our program operators the most. You go to the store and you're used to being able to buy 10 gallons of milk every other day, but the Sam's that you typically go to, they're only allowing you to purchase 2 gallons. We have requested a waiver from USDA related to meal pattern flexibilities. And my hope, fingers crossed, is that we'll be able to send out some guidance later this evening or tomorrow, because we'll have a process in place for centers that are having problems obtaining required meal pattern components. And the two key areas right now are milk and whole grains. So we understand, and we're working with USDA to try to grant that flexibility to our program participants. So watch your emails.
All right. Will the meal count sheets with names be emailed out?
We've actually uploaded the instructions for serving meals during an unanticipated school closure, the non-congregate meal form, and the meal count sheet. They are actually on our website at www.mde.k12/OCN/CACFP.
All right, and we will send that link out as well. Can you please explain further about serving food if we are not open?
At this time, the flexibilities, the waiver allows CACFP organizations to open simply to serve and to provide meals, because the need to ensure that children are receiving nutritious meals, but also practicing safe social distancing, allows CACFP organizations to open primarily and to simply provide for the food service. In Governor Reeves's emergency order, in his declaration, he specifically listed educational institutions that are serving meals to children who qualify for free and reduced price meals as essential businesses. And CACFP organization, that is all of us by design. If you are a center and you're having questions or concerns about how to do that or how that looks, some of our school districts are opening for a few hours, maybe from 8 to 10, and they're providing all of the meals that they're serving for the day during that time frame. So it's just a matter of notifying your parents when they can come and pick up meals.
All right. Will there be any allowances made by the federal government on payment Or will the reimbursement continue to be per meal served?
Yes, reimbursement, there's been no waivers or modification to the meal reimbursement process. We've had that question posed to us quite a bit. I think particularly because there has been a waiver for DHS for subsidy payments that's going to be based on enrollment and not attendance. But CACFP meals are based solely on the number of meals served.
All right. Can we serve to unenrolled students up to age 18?
No. CACFP meals are served, can only be served to enrolled children.
How do we keep up with the meal count? How do we keep up with the milk count when milk is limited in the stores?
We are working to implement a waiver process for meal pattern flexibilities, particularly around any required meal component that's not available. And we have a really simple form, and one of the areas that the participants or the requester of the waiver is going to, there's a section that says you identify your efforts made and how long this particular component isn't going to be available. So we will be able to use that flexibility waiver and compare that to meal counts for the period in question.
For those of us that buy milk by the gallon, how do we handle that?
That is one of the things that we're hoping that grocery stores and vendors heed the advice of the Secretary of Agriculture and remove the limitations surrounding the purchase of fluid milk. In his statement yesterday, he said that Mississippi dairy farmers have milk that's essentially spoiling because people aren't able to purchase as much as they are producing. Again, that would be one of those issues where the flexibility, if you're not able to purchase enough of the required component, we're going to review that as well.
How many days worth of meals can be bundled together for one pickup?
Typically, most of our CACFP meals, they're not serving shelf-stable meals. So the requirement and the advice from the health department is that there's no more than, don't provide meals that can't be consumed within 72 hours. So no more than 3 days at a time.
All right. This center says, I am currently not paying my cook through CACFP. Can my contract be amended so that the cook can be paid through CACFP?
The contract would need to be amended. The cook can be paid for any duties performed to administer the food service. So if your cook is cooking, they can be paid. I believe we've had quite a few questions about providing emergency, continuing to pay your cooks or your food service staff. If that has been, if that's included in your organization's employee compensation plan that has been submitted and approved by the state agency, you have that authority. But unfortunately, now we can't retroactively approve compensation plans when they weren't, these payment for circumstances such as this weren't included initially.
And this question is for clarification.
Okay.
Are you saying I can still prepare meals for my students while I'm closed in a grab and go style?
Absolutely.
If my center is closed this month, how should we file a claim?
The claim for reimbursement would still be for meals served during the claim period. So for centers that are closed the entire month of April, and you're not serving meals in a grab and go style, there wouldn't be a claim for reimbursement to submit.
With the grab and go, will parents need to sign in on the sign-in sheet? And what day did the grab and go start?
April 7th is the beginning of grab and go for CACFP organizations, and parents don't have to sign in. Our primary concern is the meal count, making sure that you take the meal count by the child's name.
Do you use the new meal count form for all meals served? Currently, we're closed, but plan to reopen soon, which will allow some children to attend all day.
For the meal count sheet, the new or modified meal count sheet is specifically for meals being served grab and go style. For child care centers that are open and serving and providing care all day, you'll use the same meal count sheet. You'll use the standard meal count sheet. This meal count sheet is specific to the COVID crisis.
All right. If we serve grab and go, is it only for children up to age 13, or can we serve the children's older siblings as well?
It's grab and go meals are only for children that are enrolled in the center.
All right. I'm finishing up my food program application and I haven't been able to get anyone on the phone this week. Where do I mail the application?
Our mailing address is Mississippi Department of Education, P.O. Box 771, Jackson, Mississippi 39205. And we are reporting, we do have staff that's reporting to the office at least once a week to check the mail, keep the mail flowing.
Should the children be able to come pick up breakfast and then come back for lunch and then later for snack?
Our recommendation is that organizations actually bundle meals to serve multiple meals at one time to limit exposure and to maximize resources.
If we receive the SBA loan to pay employees, will you reimburse the cook's salary?
We wouldn't, if the cook is receiving the cook is receiving salary, or the center is actually operating, yes, but CACFP will not reimburse centers for the SBA loans.
Will you be requesting the waiver to allow sponsors to monitor only 2 times a year instead of 3 this year?
We've actually submitted that request to USDA. We're awaiting their response and their decision, and sponsoring organizations will be notified of the flexibilities surrounding monitoring, but also because the waivers refer to reference desk reviews, but don't expound on what that is. USDA has left that up to state agencies to actually determine what a desk review consists of. We'll be also providing sponsoring organizations with guidance concerning what a desk review should consist of.
Over the last 3 weeks, our center was unable to purchase enough milk and whole grain bread. Will we be penalized?
Until the meal pattern flexibility waiver is granted, which that notification and the guidance will have the implementation date. Meals that did not serve prior to that did not meet meal pattern requirements are not eligible for reimbursement.
Susie, we lost the last bit of that. Could you just say that last sentence one more time?
Okay. Meals that were served that did not meet meal pattern requirements will not be eligible for reimbursement. The meal pattern flexibility guidance will have the implementation date when we get the approval from USDA.
Do we have to use current approved menus?
We actually posed that question to the health department, and the health department was very, very understanding. And their requirement is no, you don't have to use current menus, because the grab and go meals are supposed to be low risk. And some of our centers serve some really hearty meals, and meatloaf may not be easy to serve grab and go. So no, but please maintain your production records to identify what was served each day for your the components of your grab and go meals. What did they consist of?
What should we do if we've already purchased groceries for the weeks that we are closed?
Please serve meals utilizing the waivers.
If we are still operating, do we have to complete the non-congregant meal form, or do we still use the same as always?
Yes, you'll use the same meals as always, the meal count sheet as always, if meals are being served in a congregate setting on site at your centers.
If my center is still open, providing care for first responders and essential workers, do we count meals for these children separate from the grab and go meals? And if so, do we count these children as we normally would?
The centers that are actually providing childcare to children of first responders, you must ensure that the children are properly enrolled in your center. All the required enrollment documentation has to be present, the enrollment forms and the meal applications, to ensure that those children are classified in the correct eligibility category. If those children are receiving meals in your center in a congregate setting, you use the standard meal count form. For meals that are served to children grab and go, you would use the COVID-19 meal count sheet.
School districts are providing grab and go meals in our community. If we serve meals to enrolled children at the center, is this requirement to coordinate with the school districts?
No, these are separate programs. School districts are serving their grab and go meals utilizing the summer food service program and the flexibilities afforded to that program. CACFP organizations are providing meals to their target children, their enrolled children. So those they're separate consumers.
Can you tell us the approved sites?
The approved sites for
the questioner didn't indicate what approved sites, but I'm assuming that maybe it means the approved sites where school districts are distributing meals.
Yes, we actually on MDE's website at www.mdek12.org/OCN/SFSP. We have a list of school districts and sites, and also non-school sponsors, community-based sponsors that are providing grab and go meals. These are considered open sites where any child can, between the ages of 0 and 18, can come to a site and receive a meal. And we're updating that list quite frequently. I believe at least 3 times per day.
What should we do if the prepared grab and go bags are prepared but not picked up?
Because you're providing meals to your specifically enrolled children, it's kind of similar to when you prepare your meals for your production records that you're preparing. Your production records are going to reflect what you prepared, but you don't claim what wasn't served. So if your meals are low risk, some of those items may be able to be stored and served later. So I believe the best practice there is to be conservative in your preparation. If need be, kind of take a survey of your parents to see who would be interested and who's available to receive meals. That way you can kind of try to decrease your food waste.
If we're doing grab and go, how do we serve the milk that's bought by the gallon?
At this time, gallon milk would not be as useful for grab and go unless you have a specific type of cup that can store it and also maintain the temperature. If you have the ability to purchase half pints, that would be the most low risk way to provide milk for your meals.
If you get a waiver for flexibility with meal pattern, will it be retroactive to March or just from the day the waiver is granted?
From the day the waiver is granted. USDA has not approved very many retroactive waivers. We actually, in our request, we list an implementation date, and a couple of the waivers where we've listed the implementation date, they've adjusted it. So it's one of those things where we won't know until USDA approves or disapproves our plan.
Will meals be reimbursed due to attendance or enrollment?
No, meals will be reimbursed solely based on meal counts, the count of meals served and consumed by children.
How do I get the grab and go meal count sheet?
It's on our website. The email that I sent out yesterday has the direct link to the website, but that was the www.mdek12.org/OCN/CACFP. And also my email address is on is there, and if anybody had any questions or concerns or any needs, you can email me directly and I can provide it to you if you can't access it.
That's great. Thank you so much. I had a couple of comments. One provider indicated that when she told her grocer she was a child care center, she was allowed to purchase larger amounts of milk. And I had another provider who said Praise Farms and Louvel deliver cartons of milk.
Right.
Just for information. Is there a list available for foods that can be purchased for grab and go?
No, the health department's only suggestion is that the meals be low risk and easy to package. They didn't have very many concerns, but please ensure that the meals do meet meal pattern requirements. We can't have Twinkies and oatmeal pies served as the grain component.
I think you addressed this question, but I've had several come in related to how to serve milk through grab and go if you purchased it by the gallon.
Okay. Either the cartons or in a cup with a lid. That's going to be we know that so many of our centers don't have access and aren't purchasing half pints of milk, but if you're serving milk to be the meals to be transported, it needs to be stored in a container that's sealed and stored, whether that's a cup with a lid or I really think that's about it, either the half pints or cups with lids.
All right. And I believe you've addressed this as well, but this question is, if it's in my center's policy to pay my food service staff during times such as COVID-19, are you saying if it's our policy, you will continue to pay as it is in our contract?
If it's in your policy and that policy was submitted to the state agency prior to the crisis, we've received several updates to compensation plans and employee handbooks. We have to have received it and approved it prior to the crisis. Typically, we receive and review compensation plans and employee handbooks at application, initial application into the program, and organizations provide updates to us throughout their participation in CACFP. If the state agency has received it, approved it, reviewed it, and approved it, then yes, organizations are eligible if those requirements have been met.
Can we purchase covered plates for the food?
Yes, non-food supplies can be purchased. Clamshells, cups, and lids. Just please ensure that you are approved in your budget to purchase non-food supplies.
I've had a couple of questions about the difficulty buying whole grain bread. A couple of centers have indicated that there's a limit of 2 loaves per household that they've encountered, and they want to know what should be done about that.
If you are, once you receive the meal pattern flexibility waiver and instruction, if you've had issues purchasing required components, go ahead and list the dates your efforts to obtain those components and the challenges that you faced in obtaining those components. Be specific with the dates, because we need to take a look at when these meal pattern issues began. And my goal is to present a case for possible retroactive approval of meal pattern flexibilities. But the more information you provide to us specifically concerning the component, the efforts you've made, and the challenges you faced in it's going to be a very simple fillable PDF where you'll type and input the issues and responses to all those questions.
This person references back to the earlier question about whether the meals are reimbursed based on attendance versus enrollment. And this person says, my center is open, but only half of the students are attending.
Right. She would claim, file a claim for reimbursement based on the meals that were served to the children who are present.
If we close, are we required to contact the CACFP office?
We've sent out a request to participating organizations. I believe it was around the 16th or 17th that you notify us of your closure. And specifically what we ask that's included in the notification is the name of the center, the dates you'll be closed, and the number of children you have enrolled, because we are taking a manual count of how the COVID crisis is impacting CACFP organizations. And that email can be sent to Tamara Kendrick. Her email address is Kendrick, KENDRICK, at mdek12.org.
This question is about not being able to purchase the food they need from stores. For past meals where they weren't able to do that, will they be penalized for not being able to get the food they needed?
If the meals that were served did not meet meal pattern requirements, they're not eligible for reimbursement. However, once the state agency sends the meal pattern flexibility waiver request to participating organizations, if they'll complete that meal pattern flexibility request and outline, be specific about the dates and the components that were affected, we'll take a look at that and respond to their requests.
How soon do we expect for a decision to be made?
Concerning meal pattern flexibility? yesterday, but hopefully we'll hear something from USDA by the end of the day tomorrow.
If the cook comes in to prepare grab-and-go meals for a closed center, the time spent preparing meals cannot be used for the cook's reimbursement pay?
Yes,
or can be?
that can be. If your cooks are coming in to your centers to prepare and serve the grab-and-go meals, that is that salary can be paid for the service of grab-and-go meals. That's the food service is just operating a little bit differently.
So you might be submitting both a regular meal count and a grab-and-go if some kids are staying all day and some grab-and-go, or do you have to choose one or the other?
Both. If you're serving meals in both a congregate and a non-congregate setting, the meal counts, you consolidate those numbers when you submit your claim for reimbursement and maintain both sets of those meal counts in your monthly folder for the applicable claim period.
Can we drop off meals to children whose parents don't have transportation to come pick them up?
No, CACFP organizations don't have the ability to deliver meals. The ability to deliver meals is not afforded to CACFP organizations. It's specific to what the regulations call school districts, school food authorities.
Are chips allowed?
No.
Can you repeat the address for the Mississippi Department of Education, where the Office of Child Nutrition?
Okay, Mississippi Department of Education, Office of Child Nutrition, P.O. Box 771, Jackson, Mississippi 39205.
How many hours a day can food service staff be paid for grab-and-go meals?
It depends on the organization's preparation method and the number of meals that you're serving. Some organizations may be providing all of their meals in a specific time frame, say 8 to 12. Some organizations may not have the capacity to bundle meals, so their cooks may be there preparing meals at their scheduled time each day. It's really going to depend on what the organization says in their non-congregate meal form. We have a specific question that says, will the sites be serving non-congregate meals? If your meals are being served, if you're bundling meals and you're serving them in a non-congregate way, the cooks may be there their regular day or they may be there shorter. It's really going to depend on the organization and their capacity to implement their grab-and-go strategy.
In the memo, providers are required to provide instructions regarding consumption, storage, and disposal of meals, grab-and-go. Is there a template?
Right.
Is there a template available?
Yes, and if they would email me, I can send them. We have some really basic instructions from the health department, it says this meal is for immediate consumption. Please refrigerate in 2 hours or 3 hours. Please dispose of in 72 hours. If you need those instructions or that template, please email me and I can send it to you.
What is considered a low-risk meal? And what they mean is what type of foods can be served, for example?
Well, quite a few of our school districts, for example, are serving sandwiches, and they're serving fruit cups. One of the health department's suggestions is for the fruit, if they have 100% fruit juice, if they can serve that as a component. Just meals that won't, when we say low risk, that means that they're easy to store and the temperatures, that you don't have different types of meals, meal components that have different holding temperatures, hot foods and cold foods. So really just kind of a simplified to-go menu.
Could you repeat Ms. Kendrick's email again, please?
Okay, it's T.A. Kendrick, TAKENDRICK at mdek12.org.
When we're preparing the grab-and-go meals, will we be reimbursed for the to-go plates, bags, etc.?
Yes, all the supplies used to provide grab-and-go meals to enroll children, centers need to ensure that they have non-food supplies approved in their budget in Mars, which most of our organizations do, but take a moment to double check to ensure that you have requested non-food supplies, and also take a look at the amount that you've requested for non-food supplies. And also eligible for purchase for use in the food service. We've had a couple questions about additional gloves and bleach and masks. Yes, that is allowable within reason at this time. Those items that are specific to use in the food service, in your food service, they are considered non-food supplies.
Are we allowed to ask parents to bring closed cups for their children?
That's up to the individual organizations. If that's their need, I don't know if that may limit some of your parents if they don't have that. It's really going to be up to the individual organizations.
Are we able to give parents baby food that we would normally feed our infants?
Yes, infant meals can be served at this time.
Can we serve the same food items within a 24-hour time frame?
We haven't received any thing from the health department that prohibits that.
This is another question about flexibility in what foods are served.
Okay.
This person says, finding groceries has become difficult. Is there going to be, if I'm serving, say, peaches that need to be in 100% fruit juice, and I need 10 for a feeding, but I can only find 5 and 5 in light syrup, is that going to be disallowed, or is there going to be some kind of flexibility?
CACFP doesn't have a requirement around fruit being in, whether it's in light syrup. The only requirement that we're going to have is that not only do you serve the required component, but you serve it in the correct amount. In that instance, peaches are peaches. It's the peaches and not the syrup or the water or the fruit juice.
Can we still claim utility reimbursements?
Standard reimbursements apply, because even at this time, centers still have utilities. If you're approved for those things in your budget, absolutely.
Can I substitute individual juice cartons rather than serving milk in cups?
No, milk is a required component of CACFP reimbursable meals. The health department did issue some instructions to some centers surrounding the substitution of fruit juice and water for milk. That is not a CACFP requirement without a meal pattern flexibility approval from the state agency.
Where can we get the altered meal count sheet? I think you've already answered that question. Did you want to speak to it again? We got.
Okay. It's on the website at www.mdek12.org/OCN/CACFP. And that's where the instructions for serving meals at this time, the meal count sheet, and the request form will be uploaded.
I think that you've already answered this one as well, but are we able to prepare meals daily, or do we have to prepare for 72 hours?
It's up to the individual centers and their capacity. If you have the capacity to serve multiple or bundled meals, please do. If not, serve meals Monday through Fridays at the times that you're approving your application.
Again, I think that you might have spoken to this, but here's another question. If we're still open, do we have to use the new meal count sheet for the ones who are coming to the center?
No, you would use, if you're not serving meals in a non-congregate setting, you would use the standard meal count sheet, the same daily meal count sheet.
If you're under sponsorship, can you request for the utilities to be paid?
That's a conversation between the center and their sponsoring organization.
If we purchase fruit cups, does that mean 1-year-old to 5-year-olds get 1 cup? And what about the after-school ages?
The portions for the children to receive their fruit cups, in that instance, it's probably going to be more efficient to purchase fruit cups that meet the meal pattern requirements for your 6 to 12 to ensure that even your 1 and then your 1 and 2 and 3 to 5-year-olds receive the required amount. You remember, you can always give them more, just never less than the requirement.
All right. You have expeditiously answered the questions that have come through. Again, I want to thank you so much for being with us on this webinar. I want to let everyone who is watching the webinar know that we will post this information on our website. We'll have a recording of the webinar that we can make available to you so that you can go back and watch. If there are additional questions that you want to refer back to, or if there are additional questions that you didn't get answered today, feel free to send them to me or to Susie Evans directly, and we'll be happy to get an answer back to you. I want to let you know that we have, in the last couple of days, had some technical difficulties with our website. It's currently working, and we're monitoring the situation to make sure that it continues to function, because we know that you're wanting information immediately right now. So we're going to share this with all of you and continue to keep you updated. Thank you again, Ms. Evans, for being on. We're so grateful that you were willing to share all this information with us.
Thanks for inviting me.
All right. Have a good afternoon.
You too. Bye-bye.